It's another day with the physicians where your health is our business.
Growth spot the end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
Sugar, and I don't know about any other one, but what do you know?
You're welcome back to the training also on your regular program. Albinism is a group of disorders inherited in an autosomal recessive pattern that results in little or no production of the pigment melanin, which determines the color of the skin, the hair, and eyes. Although there is no cure for the eye problems caused by albinism, there are a number of treatments such as glasses and contact lenses that can improve vision. The prevalence of albinism varies across the world, with the highest incidence in sub-Saharan Africa. Let us learn more about albinism from our expert today on your regular program, The Physicians. Welcome to your regular program, The Physicians, where your health is our business. Today we'll be talking about albinism. I'm sure that rings a bell. Well, if you don't know what albinism is, Afin, Obobo, they call it different names. My name is Dr. Martina Agbere, and I'm not alone on your program, The Physicians. As usual, I have with me Dr. Memuna Yusuf Kadiri. Welcome, Memuna.
Thank you.
Now we're talking about albinism.
Yeah.
How do you used to call it when you were much younger?
You know, that time you won't have sense. So let us not say, it's now say, those people that don't enter under the sun.
Okay, we used to call our own Obobo, Obobo, Kanda, Africa, Europe.
In my place, what they call albinos, Anyai.
Anyai.
Yes.
In my place, we call it Obobo.
Yeah.
We say in Miss Road, you say the person in Miss Road is for nearly be Oyibo before, not
Oyibo. Then the way they kind of segregate them, some people don't even want to talk to them because some of them have this skin type that anytime you touch them, they kind of no, they have marks they'll bleed, and so they don't want to even touch them, play with them. So I don't get, but I've seen very beautiful albinos. Their skin very clean, clear, and I later got to know it has to do with lifestyle. So I'm sure our guest is going to enlighten the public on how those are achieved. Then of course all the myths are regard, they don't take salt, they should take salt and all.
Well, we'll get to know more about that, because oftentimes some people will tell you it has to do with the sun. So we'll tell you the bleaching cream that is actually causing it. It has broken. They're not even sure if it's hereditary
or not. No, the thing is that it has broken some. At least I know of 2 marriages that it broke.
Really?
And then both of them with normal skin color, and the lady they had albino, the man said never.
It doesn't run in my family.
And do you know what? By the time they started digging down, I think it's a great grandmom or something.
Anyway, it's a recessive gene.
Yes,
so we need to know more. Well, don't go. We'll be back after the short break. Just stay tuned. Welcome back. If you are just joining us, you're on to your regular program, The Physicians, where your health is our business. Today we'll be talking about albinism. Albinism. So oftentimes people call it different names, but then we have in our studio a renowned dermatologist, one that has always been with us and a regular face on our program, The Physicians. She's no other person than Dr. Folakemi Cole-Adeifec. Welcome to our program.
Thank you. It's always a pleasure to be here.
You're welcome. Lovely, lovely. Always a pleasure. Always.
Yes, yes, indeed.
Now we're talking about albinism.
Right.
Do you want to, is there a definition for albinism? The way you define other things, or what is albinism?
Well, albinism is a group of inherited disorders, usually inherited recessively, that result in either the complete absence or reduction in melanin in the skin, hair, and or eyes.
Okay.
So people with albinism, usually have a reduced amount of melanin. Melanin is the pigment that gives us our skin color and gives our eyes its color and also the hair. So when there is an absence of the color or a reduction in some cases, that's when you say that there's albinism. But it has to be inherited from both parents. That gene that is responsible for the production of melanin has to be inherited from both parents for the child or the person to manifest with albinism.
Wow. So it means that for a child, for somebody to have albinism,
yes,
the child must have taken from the father and the
mother. Yes.
So therefore means both parents had a history.
Yes.
Okay.
So the reason that we find that some people, their parents are normally pigmented, they have normal color, and they give birth to a child, and the child has albinism, is because the gene is recessive, meaning that we all have a pair of genes from mother and father, and the gene for albinism is recessive, meaning that even if one of the gene is normal, the person will still have a normal color. So the two genes, one from the mother, one for the father, both have to be defective before the person can now have this. So that's why what we call a recessive gene. It can skip 1 or 2 or even 3 generations and come out. So that's why sometimes it causes problems, because one of the parents would say this is not in their family, but it could have been maybe their great-grandmother or someone may have had it at that time, but nobody else manifested it since then because it's recessive. And then if they get married to somebody who also has that recessive gene in their family, in their body, they can give that to the child, and the child ends up having albinism.
So are there various types of albinism that you want us to know about?
Well, there are different types, which clinically you may not be able to distinguish the type, but sometimes you can. There's different genes, because what it is, there's a pathway to the production of melanin, and if there is a defect in any of the steps, it can result in albinism. So the different types are the different genes that are defective. So you could have the gene being defective at a point in the production of tyrosinase. I don't want to use too much grammar. In another step, so that's where you have the different genetic or genotypes. So you have the OCA1. It's OCA because it's called oculocutaneous albinism, meaning eyes and skin. Okay. So you can have OCA1, 1A, 1B. Then you have OCA2. You have brown OCA. They are different. They are about.
Okay, so you can have an individual just manifesting only in the eyes.
Yes,
and the skin.
sometimes some people.
And the color is still the same.
Yes, some people just have oculoalbinism, meaning their eyes are just very light, light color, but their skin and hair is normal color. Yeah. Then you have people who the eyes, the skin, and the hair are all affected.
But I think that's the most common, right?
That's the most common.
What are the psychosocial effects of people living with albinism?
As you've noted that there's a lot of stigma attached to albinism. Generally in our environment, we are usually afraid of what we don't know. And because people don't know much about albinism. They tend to be afraid of it. And then, of course, the color contrast, where you have a family where you have a very dark-skinned, I mean, everyone in the family is dark-skinned, then they just have one child that is just white, you know. And in some families, they may begin to think of diabolical things or some form of witchcraft. In fact, it's a problem in some parts of Africa where it is believed that children, people with albinism, are very good for making blood money, and so they are actually hunted and killed for their body parts, which doctors say it can be used for blood money to make people rich. So it's a very major problem in this part of the world, you know, with the social stigma. A lot of people make fun of people with albinism because, you know, they have the reason their eyes do not have the pigments required for, you know, proper processing of light, and because of that, they tend to not see very well. So their eyesight is very poor. And in school, you know, children make fun of them because before they can see, they have to put the book right here, and you know, children can be a bit insensitive and make fun of them because of that.
So it's not compulsory that somebody who has albinism will give birth to a child who is also...
No, if a person with albinism marries somebody with a normal color, they can have perfectly normally pigmented children because, as you said, it's recessive. So once that albinism gene meets with a non-albinism gene, the non-albinism gene will always win. So the child will have a normal color. Except that person also is has albinism. Two people with albinism cannot give birth to a child with a normal color. They will have albinism.
Now let's talk about the complications.
Yes.
You already made mention of some. Like, you know, melanin is protective.
Yes, it is.
And because it's defective in albinism, they are prone to having some disease conditions, right?
Yes.
What are the complications?
So the main complications on the skin are the effect of UV ray damage. So what we call photosensitive skin conditions. So that results in sunburns, just like white people, for instance. When they come to Africa, if they don't use their hat or their sunscreen, they get burns, their face goes red, and they can actually, the skin can actually peel. So albinism, people with albinism have similar problems. And then when that is sustained or recurrent, it can result in skin cancer.
So I've seen very lovely looking albinos, like clean skin. The only thing is the eyes kind of, you just know that, okay, this person is living with, you know, this disorder.
Yes.
What changed? Why are they not having all that redness, wrinkles, sores? And this particular family is not like they are like posh or very wealthy that you think maybe it's money. So is that a different type of albinism, or there's something they are doing differently that they're not having those physical presentation in their skin?
Well, what we realize is that some people realize the key thing to managing a child with albinism early, and they realize that the problem is sun exposure. So once a family knows that this my child has albinism, he or she cannot stay under the sun for too long. They find that their skin is preserved. So you have some people that they know that, and what they do is that they protect the child from going out in the sun.
Doctor, please just hold it right there, because you would need to explain some things when we come back from this break. Because you talked about early exposure being like an antidote, something that is very, very important. I'll ask you some very, very important questions when we come back. Don't go away, we'll be back after this time out. I just want to keep a date with the physicians out here.
Yes, sir. They cannot see well at daytime.
They are a bit fairer than the normal set of people we see.
I do not believe so.
It isn't. I feel it is hereditary.
I believe it's from God.
Under secretion of the melanin hormone in the body.
Albinism is is a part of a trait in a family.
The advice being given to us is that you must not meet your wife in a daytime.
No, not at all.
Yes.
Treatment specially doesn't really need to be.
About that, I'm not certain, sir.
I feel it's hereditary.
I believe most of the times these people are being stigmatized.
They are nice people.
If I'm to give advice on this, so I will tell you don't meet your wife in a daytime. Oh.
Welcome back. If you're just joining us, you're onto your regular program, The Physicians, where your health is our business. We've been talking about albinism, and doing justice to that particular topic is Dr. Folakemi Cole-Adeifec. She's told us a whole lot about albinism, and before we went on break, she talked about like early detection, something that can make you go deal with it much better. Dr. Cole, that was what you said before we went on break. I want to now ask you, at what point can it be detected when you have a child? Is it from birth that you know that this child has albinism? Then the parent can start? Or do you also educate the parents when the woman, when she's pregnant? At what point, so that they know what to do, when to take action?
Well, it is possible to detect albinism at birth. Like I said, since it's a genetic disorder, it will be there from birth. However, usually you want to wait at least 4 weeks, 6 weeks, because when children are born, they may look,
Okay,
you know, just like a newborn, and then after some time they begin to change. But in the case of albinism, when they are born, you know, and they begin to grow, you know, they notice that the hair color doesn't change. If it affects the hair will remain yellowish or whitish or, you know, brownish, as the case may be. And of course the eye color, sometimes when they are born it may be a pinkish color. It may eventually, you know, get a bit darker, or it may not get a bit darker, but it's present from birth. Yes, so it's not really possible to diagnose it before birth, you know, because you may not know that there's a family history, and it's not one of those things that you want to do prenatal diagnosis for. But once the child is born and they begin to see that, oh, this child has this color, then one can begin to, you know, make certain, take some certain steps and interventions to make sure that the child's skin and nails are well, skin and eyes are well cared for. It's very important, like I've said. The main problem is with albinism, they don't have the natural protection of melanin. So such children should not be exposed to the sun excessively, or even as much as possible, they should be shielded from sun exposure. So from a very early age, the mother is taught that this is your baby, try to buy long clothing, even if they are not thick, so that the child is not hot. You shouldn't wear sleeveless clothes. They shouldn't wear sleeveless clothes, especially when going outdoors. They should try to cover the head and not leave the head. Sometimes, you know, a mother will back the baby and just leave the head open. But a child with albinism, you want to encourage the mother to always wear a hat, or the father to always wear a hat for that child. And of course, even in school, when they start school, we always tell our mothers that have children with albinism, fathers that have children with albinism, to come for a medical report, because most school uniforms are inappropriate for children with albinism. So we can write a medical report that they can come and get medical reasons for why their uniform should be different. Long sleeve trousers, long sleeve shirt, and face cap, because children always want to play outside. So it will be very difficult for you to tell a child that you should not go out at all. So you want to make sure that even if they do go outdoors, they are protected. So you need a face cap, because one of the commonest places where they tend to get all these skin cancers and skin issues is on the face, the head and neck, because that's what is closest to the sun and is, you know, exposed the most. The face is exposed the most, and the head. So you want them to use face caps. You want them to also use sunglasses as frequently as possible. And then, of course, the sunscreen. Sunscreen is a cream that acts as melanin. So it blocks the sun's rays from penetrating into the skin, or absorbs the sun rays into the cream so it doesn't penetrate into the skin. or it can reflect it back. So that sunscreen cream is very, very essential for people with albinism. Even with dark-skinned people, it has some benefit because it helps to slow down the aging process, because the sun's rays can age us faster. And when we use sunscreen, you slow down that process. But it is even more and more, important and essential for people with albinism because they don't have any melanin at all to protect them. So if they use the sunscreen on the exposed parts of their body, they are less likely to develop blemishes on the skin and things like that. The challenge with sunscreen is the cost.
Yeah, I was going to say that.
The challenge is the cost. So a lot of people cannot afford
any natural alternative to that?
Well, not that we know of. There are a few powders that contain zinc oxide that our forefathers and foremothers used to use, but they are not readily available. So the best or the most practical thing is to use clothing to cover the affected parts of the body, and wear sun hats and sunshades.
But aside from all this, the sun, non-exposure to sun, wearing long clothing, face cap and all that, are there other ways of managing somebody living with albinism? For example, dietary.
Well, a person with albinism should have a good, healthy diet. Lots of fruits, lots of vegetables, just like the average person. There are some studies or research that shows that vitamin B3, niacinamide, reduces the rate of development of pre-skin cancer lesions like actinic keratosis and skin cancer. This study was a large study done in Australia, where they have a lot of sunlight like we do in this part of the world. And they have a lot of white people, so a lot of them tend to have skin cancers. But they discovered that supplementing with vitamin B3 reduced the rate of people developing skin cancers. So that's the only scientific study that shows that, a particular dietary supplement can be beneficial. Okay. Some myths say that salt is part of it, but there's no scientific evidence to prove that salt has any role to play in albinism or in the development of the skin issues or skin rashes. So I always tell my patients with albinism that they can eat salt, of course, in a moderate manner, but that avoiding salt is not going to make any difference. What they need to avoid is sun exposure.
Okay. So before I let you go, I just want to say something.
Yes.
The Caucasians and Africans, is there any prevalence?
Yeah, so it's known that albinism is commoner in Africans, sub-Saharan Africans, even though in Caucasians they do have people with albinism. It may not be so obvious because they are white, but for us the contrast is so much so we see it. Prevalence is about 1 in 10,000, 1 in 13,000 in us, in Africans, while in Caucasians it's about 1 in 15 to 20,000 in some areas. Okay. In some places more than others, but it's known to be more common, in us. But albinism must be seen as just a minor skin disorder that can be well managed, and people with albinism should be treated with respect, with love, with dignity, and they shouldn't be made fun of at all. They are beautiful people, they are special people, and we should see them that way.
So thank you very much, Dr. Cole. It's actually a pleasure having you again in our studio, and you actually have enlightened us. We have to keep it brief. Albinism is not a disease, it's just a common skin disorder. I like to take home. So as usual, I'm sure you have heard it from the experts. Keep it brief, stay with them, love them, show love, dedicate your time, and be with them at all times. In school, ensure that they are sitting in front if they have challenges to always.
Yes. Thank you, of course, Dr. Folakemi, Cole-Adeife. It's always awesome to speak with you, and your wealth of knowledge is very key at this point in time to everybody and all our viewers at home. Please always keep a date with us on this program, The Physicians, because your health is our business. And don't forget to follow us on all our various social media platforms. And if you want to be part of our guest on this program, we are just a click away. Till next time, stay blessed.
And as usual, I'm Dr. Martina Agbere. Have a wonderful day.
My name is Folakemi Famuyua, a consultant hematologist at General Hospital Bagada, and today I'm on Physicians talking about sickle cell disease, its causes and complications. Thank you.